In Bangladesh, 43.6% rural people cannot connect with digital medical health, not for illiteracy, just for not having 4G, 5G, OL internet connection. For the cloud structure, when infrastructure fails, all are spoiled. For not having strong data exchange system, we cannot connect with urban medical and lots of data history is lost and data-driven solution hampered. To bridge this gap, we built LifeSync AI. LifeSync AI, a telehealth offline system where we found out that people have in Bangladesh 98.9% at least one mobile phone. But for not having 4G or 5G connection, they cannot connect with digital medical system. In AI consult button, if we go to AI consult, we can directly search anything which we need for the solution. Like if we have fever, we can search the fever, and in there we can get the solution from the AI. Secondly, from the people for the pregnancy care, we created a pregnancy system. Like they can track their health system by the weekly basis. If he or she is in the week of 10 or week of 12, what's the baby condition is, she can detect by that. Secondly, they can also detect the kick of the babies and understand that the procedure of the baby is well or not. In this, there is a 10 kick by the 2 hour is the normal detection. If it's normal, they can detect it by the easy way. And also there is a risk parameter. By that, they can get by their weight, by their height, and by their body pressure and the diabetes, they can get that is she is in a risk position or is in a normal position. And it will get easily the metrics of the risk parameters. And there is also a risk score that it can be get that he is really a urgent scenario or not. Thirdly, a medical center hub. Like in that they can get their information in there, and for that the medical hub will be get the infrastructure in the online. Like the data will be connected in there if you give the data, and by the data it can be synced in the offline by the offline system. And after 1 day, the offline data hub will see the data and they can give the solution by SMS or by the phone call. And fourthly, is the most unique features of our is telehealth offline. Like we already said, there are lots of people who don't have 4G or 5G internet, but for the that time they have the button phone also. By the button phone or the 2G SIM connected, they can get the solution by their own phone. Like they in the button phone, they can press the 1 or 2 in that hotline number. They can get the solution by SMS in 1 working day. Fifthly, there is a nutrition AI. In nutrition AI, they can get a nutrition solution or nutrition advice also. Like if they eat bread, if they eat meat, what kind of protein she will be get, what kind of cholesterol or what kind of calories she will be get, that kind of thing will be given by there. And sixthly, there is a risk parameter. In risk parameter, they can get there is a hypertension or is there is a smoking problem. That type of risk analysis will be given in there, and it can be measured that is he or she in a risk factor or not. And lastly, we have an admin report, which is not built in a demo system. In the admin report, they can see that how many cases have in their system and what's the solution of given and what the similar cases we have in their system. So they can totally monitor the discrimination to the rural and urban medical system. And by their any phone call or any phone, they can connect it with our LifeSync AI. Thank you.